When it comes to making decisions, it's seriously a two-step process, right? It's a two-step process when it comes to decision making. I often talk about decision making quite a bit because as therapists, as occupational therapists, and as someone who specializes in hand and arm injuries, we are the experts, and you have to get that into your mind that you are the expert. You know more than your patients. You have to believe it, and therefore you will continue to work to make that be more true and more true every day. There's a lot of knowledge that you have, and what you need now to do is to take that knowledge that you have and apply it, because patients don't know what you know. Patients don't know what you know in terms of the rehab process. They're gonna read a lot of stuff on Google and stuff like that, but you have the ability to take all that knowledge and make it succinct and then apply it. So in the decision making, there's a two-step process. You learn, and then you make a decision. It's literally that simple, right? You learn about what's going on, and then you make a decision about what to do. So you learn about them. For example, let's say I'm talking about carpal tunnel, right? I'm getting a ton of nerve injuries, and I often talk about surgical cases being one way and non-surgical cases being another way. You can take the same thing here and you can apply it to the same, So I'm going to do that today. So let's say we're talking about non-surgical case, carpal tunnel, right? What do you know about carpal tunnel? You may know nothing. You may know something, right? And you may know a lot, right? From that knowledge, you're going to apply it and make a decision, right? So if you know nothing, go look it up. It's a nerve problem. I mean, majority of the time we know something. We know something before that patient comes in. You don't have to know everything before every single patient comes in. You just need to know enough to get that one patient through the door so that you can find out, you can learn more, right? Set them up and then make a decision about what to do next. If you know something, you know that it's a nerve. You know that you might splint, right? You know that you might need to do some kind of exercise, right? Here, if you know a lot, you're going to be able to rule in and rule out. Is it really carpal tunnel, right? That kind of stuff. Your practice might be more advanced in terms of manual treatment, in terms of taping, in terms of any kind of techniques, right? So let's say you know nothing, then first of all, you sort of should look it up. And one of the things that I always do is when a patient comes in and I know absolutely nothing, I come, I greet them. So what's going on? Okay, let me take a look at the script, and then I'll be like, okay, so I'm gonna get an idea of what's going on. And then I'm going to be like, okay, finish your paperwork and I'll be right out to get you in a few minutes. Go back, look some stuff up, and get an idea of what you could do, right? If you know something, there's a couple of different things that you could do. And then if you know a lot, then you're really good, right? But you then have this knowledge that you have, and then you want to learn about them, right? So it's in what we do as therapists that we're going to tie this to them. We're going to learn about them. What do they want? What do they want? What are their symptoms? That kind of stuff. And then therefore you can at least set up and make a decision about what you're going to do next with them, right? And usually it's, yes, I can treat you, and let's do X, Y, and Z today. And if they try to take you too far ahead, like, well, I'd like to see how this one session is going to do, and then from there I'll be able to give you paint a better picture the next time. every time you see them, you're trying to buy a little extra time, but you've got to be really smart about it so that you go away and you get more and more information to learn. And then when you come back to them, you can make a decision. Yes, we're going to try it, and then the next time you come and you see them, you can be more clear instead of vague, right? But at the end of the day, it's a two-step decision making. You learn about them and you make a decision. Yes to therapy, no to therapy, right? Most of the time it's going to be yes, right? Most of the time it's going to be yes, and you can have a generalized way of treating, and then you can start real generalized and then go more specific. This is a non-surgical case, right? So when you're talking about surgical case, you're going to learn, it's the same thing, you're going to learn. So you know about healing more than they do, right? So let's say it's a surgical carpal tunnel, right? Well, what do you know about carpal tunnels, surgical-wise? It's a median nerve, right? All you're doing is you're finding out what their symptoms, again, it comes down to them, right? It comes down to them. What are their symptoms, right? Most of the time, if they had surgery, their symptoms are going to be pain. Their symptoms going to be numbness. Their symptoms going to be decreased range of motion, something like that, right? So you're just gathering some easy things, and then from there you can make a decision about what you're going to do next, right? And each time you make a decision, it doesn't have to be the whole decision. It can be a small decision. That's what I'm saying. The one small decision is going to take you to the next step, right? So if they come in on Monday and they're like, oh my God, I have so much pain, I had this surgery, what the hell was I thinking? My hand is so blah, blah, what do? You learn about them. What do they like? What do they want? Most of the time they just want less pain. Okay, so we're going to work on that. Take their words. I hear you, I see you, you have pain, you have less motion. I'm going to help you to reduce your pain, to get more motion, right? And so from today, we're just going to do X, Y, and Z. We're just going to help reduce some of that pain, get those fingers moving a little bit, and I would love to see how you respond to this session, and that's going to help determine how fast or slow we move in the next session. All right, I need you to be honest with me and tell me, if I was being too soft with you and you didn't really feel anything, or if I was too rough with you and you had too much pain, right? That's how you learn. You're learning about them. Then when they come back, you get to make another decision. First decision is like, okay, for sure you need therapy, right? For sure, 100%, I could help you. All that stuff, you need therapy, right? How often you need therapy is a whole nother topic of conversation. Usually with our private patients, we're like, how fast or slow do you want to go, right? And these are my recommendations. When it comes to insurance and workers' comp, it can be a little bit of a different story because you're going by certain other people's guidelines. If it's workers' comp, it's like, well, your doctor wrote 3 times a week and I agree with it 3 times a week. And yes, I need you to come 3 times a week for 4 weeks, right? Yes, you need therapy. Your doctor wrote twice a week, but to be really honest with you, you're so stuck, you're so painful. I really believe that coming 3 times a week is best for you and in your best interest right now. And I'm going to communicate that to the doctor. I'm going to write that in your progress note. Do you agree with me? Do you want to come 3 times a week? Right? Okay, perfect. Well, it sounds like you have pain, you have numbness, and the doctor wrote 3 times a week, and I agree that it's 3 times, or what is it? It's 3 times a week, but you're not that bad. You can come twice a week. Do you agree? That one's a little tricky because if it's workers' comp, they have to come 3 times because you have to follow the doctor's plan of care. But if you say, I agree with the 3 times a week, doctor wrote 3 times a week, I agree with the 3 times a week, patient's like, I can't come. Okay, you only want to come twice? I'm going to write it in your note. Doctor wrote 3 times a week, I recommended 3 times a week, patient says they can only come twice. So these really comes down to this is your decision making, right? So everything that I teach in this course and I work with all my students and stuff like that, it's really that to enable you, to empower you to become the decision maker. And it's all about the learning and then the being able to make a decision, right? I know I break it down, make it seem really easy, but it does take a little practice and it can be a little bit challenging, but over time it's going to get easier and easier. And as long as you understand why, you'll always be able to make that decision.